Dr. Williams, can you expand on how it can be that someone can test negative for this and then it later turns out to be a positive result?
That's why we brought Dr. Allen here, and I'm just saying that in this testing aspect here, as all our labs are working at raising the and the sensitivity in different aspects, it's a dynamic discussion, we're saying. But during that time, there's been no compromise in the positive cases. So I'm going to ask Dr. Allen if you can comment on what does that mean and how does this dynamic process work?
Thank you very much, Dr. Williams, and thank you for the question. So we really had the sequence for the virus on January the 10th, and the Canadian lab system has been working together to get very rapid, reliable tests. The test on this individual was done a week ago, and at the time that was the very best test. It was the original test that we had all been working on collectively. And we continue to work together to get the very best test. So the original test was done well, it was done properly, it was appropriate. And then the second test was then laid on several days later, 4 or 5 days later, and we all have new tests that we've run it against, and it's picking it up. So this is part of the science of the way that we develop rapid tests for a response to a new pathogen that we're just learning more about, and really working lockstep together as a national laboratory system to make sure that we get the best test at any given time, that we continue to work together to get the best test, and that we continue to work to improve that.
Does that mean that if people test negative, that they could then be carrying this and not aware?
Okay, let's how we've done with those ones that we have tested negative, and how you continue to reassess that and to affirm the status.
So we are continuing to run all of those samples on the newer test, both at Public Health Ontario and at the National Lab, and we are concurrently having conversations with other laboratories across the country to make sure that the tests are the very best tests that we can provide. So these are all being run in parallel as we speak, but the methodology, as one can understand with a very new virus, is one that rapidly advances, and that's what we're here to do, is to rapidly advance the test.
Elaborate a little bit more on the criteria, what you're looking at in this second test that might be a little bit different from the first that would deem it a positive result?
Yes, so we are currently at Public Health Ontario using 2 tests, and the National Microbiology Lab applied several days later 5 tests to this sample, which we are currently in the process of implementing. And so really it's about moving that field forward together. They actually look at slightly different parts of the virus and making sure that it's there, and it wasn't positive on all of their tests. So again, validating that we're really trying to move together to get the best answers for individuals and their diagnosis.
Anybody else in the household?